Welcome to the Omnidental Podcast.
Glad to be here for this one.
Yeah, so you might think the first sign of an autoimmune disease would be, I don't know, a stiff, swollen joint, or maybe a wave of chronic fatigue that just, won't lift.
Right, the classic symptoms.
Exactly. But what if your body's earliest distress signal wasn't in your joints or your energy levels at all? What if that warning siren was actually hiding right there in your gums?
It's totally wild to think about.
It really is. So today we are taking a deep dive into an area most people entirely overlook. We are exploring why your mouth, the oral cavity, might actually be the front line of the battle when it comes to systemic autoimmune conditions.
Absolutely.
And we are drawing on a stack of sources today from Omnidental, specifically unpacking this really comprehensive July 2026 article by Shiva Malik-Poor, just to, sort of understand this whole complex relationship.
Yeah, and to help visualize the sheer scale of what we are analyzing today, the visual backdrop behind us has actually shifted.
Oh yeah, it looks amazing.
Right. We are looking at this glowing, highly interactive anatomical model of the human body. But instead of just showing, bones or muscles, this model maps the human immune system.
It's practically glowing.
It is. We can see the lymphatic vessels, the white blood cell pathways, the cytokine networks, and the model traces these complex pathways directly into the oral cavity, right into the mucosal tissue, the salivary glands, and the jawbone.
Just right into the teeth.
Exactly. It vividly illustrates that the mouth is not, separate from the body. It is deeply interwoven into your systemic health.
It is an incredible visual. And it perfectly sets up our mission for this deep dive because for you listening at home, we are going to explore how autoimmune conditions fundamentally alter the cellular environment of your mouth.
It's a huge shift.
Yeah. And we'll look at the paradox of how life-saving systemic medications actually complicate oral healing. Plus, we'll break down the collaborative care model required to navigate this safely.
Which is so crucial.
Definitely. So before we look at clinical solutions, we really need to understand the biological mechanics. Okay, let's unpack this.
Let's do it.
If we assume you, the listener, already understand the basic premise of autoimmunity, the body basically attacking its own tissue, how does that specifically alter the day-to-day environment of the mouth? I mean, I tend to think of the immune system like bouncer at a club.
Right. Oh, I like that analogy.
Right.
Yeah.
Like in a healthy person, this bouncer is vigilant. It scans the mouth, flags the harmful bacteria, just keeps them out, neutralizes them. But with an autoimmune condition, it's like the bouncer gets totally confused and just starts throwing out the VIP guests.
The VIP guests being your own healthy tissue.
Yes, exactly.
That bouncer analogy is highly illustrative, honestly, because oral tissue relies on a perfectly balanced immune system to just fight off bacteria and heal.
Just normal, everyday healing.
Right. When the immune system is overactive or, like you said, misdirected, things go wrong fast. So when plaque bacteria gather below the gum line, your body doesn't just send a measured response. It triggers this rapid, ongoing inflammation.
Like an overreaction.
A massive one. It leads to periodontal disease that, honestly, just heals incredibly slowly. The macrophages flood the area and actually begin breaking down the ligaments holding your teeth in place.
Oh, wow. Wait, so is this just a blanket effect for every autoimmune disease, or does the mouth react differently depending on the specific diagnosis?
Oh, it's definitely specific to the diagnosis. The source material breaks down exactly how different conditions alter the oral environment.
Okay, give me some examples.
Well, consider rheumatoid arthritis. We usually associate RA with joints, right?
Yeah, like stiff hands and knees.
Right. But in the mouth, this often leads to a higher rate of severe gum disease and some really intense jaw joint stiffness.
Oh, and the TMJ.
Exactly. And then you have Sjögren's syndrome.
Okay, how does that one work?
That one directly affects the salivary glands. The immune cells basically attack the glands, causing severely reduced saliva.
And saliva is super important, right?
It's your main defense. Without it, your mouth gets highly acidic, and you're suddenly prone to rapid tooth decay and fungal infections.
Likes? What about lupus?
With lupus, it manifests as these really painful mouth ulcers and highly sensitive oral tissue.
Just general hypersensitivity.
Yeah, it's miserable. And then there's Crohn's disease.
Wait, Crohn's? Isn't that digestive?
It is, but the digestive tract starts at the mouth. So Crohn's can actually cause the tissue in the mouth to swell up and take on this strange sort of bumpy cobblestone texture.
A cobblestone texture inside your cheeks?
Yes, it's wild. But what's fascinating here is that these specific oral symptoms often appear before a patient even knows they have an autoimmune condition.
Really? Like an early warning system?
Exactly. So for you listening, this is why you have to pay attention. You need to watch for persistent dry mouth or a burning sensation, unhealed ulcers, swollen or bleeding gums, even white patches which indicate fungal infections, or just sudden difficulty chewing and wearing your dentures.
That is such a huge takeaway. If your dentures suddenly don't fit, it might not just be a dental issue.
Exactly.
But okay, we need to transition here because we have to move from the diseases themselves to a secondary, honestly kind of terrifying complication.
The medications.
Yes, the medications. We're looking at how the very treatment saving a patient's body might be harming their teeth and gums. Here's where it gets really interesting.
It's a huge paradox.
It is. It's like taking autoimmune medication is like lowering a spaceship's shields to route all the power to life support.
That makes total sense.
Right. Like it fixes the main crisis, your organs failing.
Yeah.
But it leaves the ship totally vulnerable to space debris,
Mm.
which in this case is just everyday oral infections.
That is the perfect way to visualize it, because these specific drug classes really alter the oral environment. Let's look at immunosuppressants and corticosteroids, for example.
Yeah, what do they do?
Well, by lowering immune activity, they massively spike your risk for fungal infections, like oral thrush.
Thrush is awful.
It is. And corticosteroids specifically. They slow wound healing down significantly. Plus, with long-term use, they can actually reduce your jawbone density.
Wait, seriously, they melt your jawbone?
Essentially, yes, it makes the bone porous.
That is terrifying. What about other drugs?
Then you have DMARDs, like methotrexate.
Okay.
Methotrexate stops rapid cellular division, which is great for stopping inflammation, but your mouth tissue replaces itself constantly. So as a purely direct side effect, these drugs can trigger agonizing mouth ulcers.
Just from the drug itself, not the disease.
Exactly. And then there are biologic therapies. They alter immune function in ways that unpredictably affect healing times. It makes infection risks highly unpredictable.
Wow. So you fix the body, but wreck the mouth.
Well, and I need to stress this to the listener. This is absolutely never a reason to avoid your medication or skip the dentist.
Right, don't just stop taking your life-saving drugs.
Please don't. Rather, this is the exact reason why careful pre-planned dental care is so necessary. You can't just fly blind anymore.
So what does this all mean for someone sitting in the dentist's chair? I mean, if their immune system is suppressed and their jawbone density is altered, can they even get normal procedures done safely, like a cavity filled or an implant?
Yes, they absolutely can. Most patients with stable autoimmune conditions can safely receive routine cleanings, fillings, and even complex dental implants.
Oh, that's a relief.
But, and this is a big but, it requires a highly coordinated medical collaboration between the dentist and the patient's physician or rheumatologist.
Okay, so they really have to talk to each other.
Exactly. The dentist isn't just working in isolation anymore. They have to map out these specialized care plans.
What does that look like practically?
It means more frequent checkups, for one. They also use much gentler techniques for sensitive tissue, and they strictly monitor the timing of medications.
Like scheduling around the drug doses.
Precisely. For major work, the dentist and physician might actually adjust the dates a patient takes their immunosuppressive medications to allow for a healing window.
That makes sense. But isn't there a huge infection risk?
There is, which is why they may also prescribe a short course of antibiotics before a procedure. It proactively lowers the infection risk while the immune system is suppressed.
Okay, so for you listening, this means you have to be an active partner in this collaboration. You can't just passively sit in the chair.
You really can't.
You should always bring a current medication list with you. And I mean everything, exact dosages, any recent changes, everything.
Yes.
And bring your rheumatologist's contact info too. Plus, if you have any notes on new, even minor oral symptoms, bring those up at your visit. Don't hide anything.
That information is basically the armor your clinical team needs to keep you safe.
Completely.
Yeah.
All right, so let's move from clinical treatments to daily life. We need to outline the exact steps the listener must take at home, right in their own bathroom. And we need to introduce the local experts who are equipped to handle this collaborative care.
At-home care is actually where the real battle is won or lost.
Really, just brushing and flossing.
It's more than that. Because gum disease progresses so much faster with autoimmune conditions, consistency matters way more than intensity. You don't
Oh,
want to aggressively scrub. The listener should use a soft bristled brush, a good fluoride toothpaste, and floss very gently to avoid irritating the sensitive tissue.
so no scrubbing till you bleed.
Please, no.
Uh-huh.
And crucially, they must avoid alcohol-based mouthwashes.
Wait, really? People love that burning feeling. They think it means it's working.
It's the worst thing you can do. Alcohol dries out the mouth, which severely worsens dry mouth symptoms. If you have Sjogren's syndrome or medication-induced dry mouth, alcohol just desiccates whatever moisture you have left.
Oh, wow. Okay, so what should they use?
They should use saliva substitutes if needed. Make sure to stay super hydrated and aggressively limit acidic or sugary snacks.
Just engineering a very safe environment in the mouth.
Exactly.
Now, if you are dealing with an autoimmune diagnosis, you really need a practice that gets this. Which brings us to the source of today's deep dive. Omni Dental of Arlington Heights.
Right?
They're located at 305 E Rand Road. And they really specialize in this kind of complex care.
They do. If we connect this to the bigger picture, Omni Dental, which is led by Dr. Belis Poles, who, by the way, has over a decade of experience.
Yeah, he's incredibly experienced.
They just embody this exact patient-first, collaborative mentality. They treat their patients like family. They really recognize how these dental conditions impact overall bodily health.
And their capabilities are just vast. I mean, not only do they use state-of-the-art advanced technology for, accuracy and highly conservative treatments, but they're also an environmentally conscious practice, which is super cool.
It really is.
And they handle everything. I mean, from deep cleanings, sealants, and root canals to the highly complex stuff.
Like the implants.
Yes. Complex implants like all-on-4, full arch, and bone grafting.
Which, if you remember the corticosteroid bone density issue, bone grafting is incredibly relevant here.
Exactly. They can literally rebuild that lost foundation. Plus, they do cosmetic dentistry, Invisalign, smile makeovers, gummy smile correction, and they have full emergency dentistry.
Which is a safety net you absolutely need with autoimmune disease.
Totally. And they even go beyond teeth. They offer all these amazing aesthetic services.
Oh, right.
They do Botox, Sculptra, microneedling, laser pigmentation removal, scalp micropigmentation, and even IV drip therapy.
The IV drip therapy is fantastic for patients battling severe dehydration from things like Sjogren's syndrome.
Exactly. It's a genuinely holistic approach to care. And Omni Dental is ready to serve listeners not just in Arlington Heights, but in a ton of surrounding communities.
They have a huge reach.
Yeah, they serve Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
That covers a lot of ground.
It does. And you can reach them at 847-483-8833. Let me say that one more time. 847-483-8833.
It's so important to have local experts who can actually manage this level of complexity.
Okay, so let's just briefly recap this whole journey. Today, we looked at how autoimmune diseases basically trick the body into attacking the mouth.
The confused bouncer.
Right. And we covered how those life-saving medications unfortunately complicate oral healing. But we also talked about the vital importance of dentist-physician collaboration and how practices like Omni Dental are perfectly equipped to manage it all.
It's a lot to take in, but it's totally manageable with the right team.
It really is.
I have a final thought on this, just something for the listener to mull over.
Oh, okay. Let's hear it.
We usually view the mouth as just one small room in the giant house of the human body, right?
Yeah, just a small part of the whole.
But based on how early these symptoms show up, what if it's actually the front porch?
Oh, I like that, the front porch.
Consider this. What if, in the near future, the key to diagnosing complex, systemic autoimmune mysteries relies entirely on your dentist? What if they can diagnose you just by recognizing the subtle microscopic topography of your gums and tongue long before your first joint ever aches?
That is incredible to think about. Your dentist is your very first line of systemic defense.
Huh?
Next time you're brushing your teeth, you're definitely going to look at your gums a little differently.
Oh.
Well, that is all the time we have for this deep dive. Thanks for listening, and we'll catch you next time.